So, my name is Greg Spurler. Number one, I'm the NationWide deferred comp rep. So if you ever see my name coming around, it's to talk about deferred comp, which helps fill in the gaps in retirement. So a lot of little caveats to the deferred comp plan. So it's good to always check in, see if we've added any bells and whistles to the plan, if there's anything to take advantage of, whether you're brand new, just starting your career, or at the end of it. So today we're going to talk a little bit about some of the things to consider as you get closer to retirement. A lot of big issues come up at that point. From healthcare, which is always the linchpin decision on how you're going to transition from an insurance plan at the county to a Medicare plan, to buying supplements, things like that. And really overall, how is it going to affect your overall retirement? How do the different retirement plans work together? One of the big things that I get pretty worked up about, if you ever work with me, is starting to do the planning with how you're going to utilize the different plans. Start that planning at the beginning. Or if you're towards the end, maybe changing what is being done to take advantage of different parts of para or the pension plan, or Social Security or deferred comp. So they all play together, and it's important that we know that when we start the planning process. A little bit of disclosures, of course. I'm not an attorney, I'm not an accountant, not a CPA. If you need professional guidance, we of course want to bring those people into the equation as you're doing your overall retirement plan. So the big things that we have to take into consideration when we are getting ready for retirement, or specifically when we're approaching retirement, and some things that might have been addressed all the way along the way, hopefully that's the case, but some of these creep up on people as last minute thoughts, and there needs to be some structure built around them at the last minute. The big one that I hope most people hear about a lot, and I bring it up as often as I can, is inflation. Every dollar that you're saving for retirement is going to be worth less when you get to retirement. So it's important that we beat the inflation rate when it comes to investing. That's why when it comes to deferred comp, or even the pension plan has a built-in mechanisms to try to combat the effects of inflation on your overall retirement. When it comes to the investment part, which is what I deal with the most, we realize that the best way to combat inflation is through the capital markets, stocks and bonds. Sometimes that's scary, especially if you've seen what's going on in the market the last couple of days. I suggest turning off the TV. There's a lot of things influencing the market that are beyond anybody's control. Coronavirus, oil trade wars with Saudi Arabia and Russia, those things ultimately play out, and we get back to normalcy in the markets. And any 10-year period in the stock market returns between 7 and 9%. So that's a great way to beat inflation when inflation averages around 3.25% over history. Of course, the big thing, I've already touched on it briefly, healthcare costs and long-term care. Probably the biggest expense that anybody's going to encounter in retirement. I think the average person, a recent survey, can expect out of pocket around $250,000 through their retirement. That's a big chunk. Of course, it's not all in one lump sum. You have a lot of income streams that come into play, and it's over an entire retirement, but it's still a big chunk of money that has to be addressed and has to be kind of earmarked that it's going to be used up in retirement. And then probably the one that most people don't even consider is what long-term care is going to cost. statistics, but I do know that the average stay in a nursing home is about 3 years if you do need long-term care. And on average, it's gonna cost about $6,000 a month. So that can be a big anvil on the overall retirement plan if those events happen. So they should at least be addressed and understood that they are a risk to the overall plan. And somewhere along the line, at least be addressed when it comes to that planning. And tying into the health insurance, the better health care that we receive, it's just helping us live longer. So if we were planning on living a 30-year retirement and we end up living a 35-year retirement, that extra longevity should be accounted for in the end. So building some guaranteed income streams. Now the great thing about working at the county is that you have access to para, which is an income stream that you can't outlive. Most of the employees will have Social Security, which is an income stream that they can't outlive. And if you're utilizing deferred comp and whatnot, there are ways to make that an income stream that you can't outlive, even though a lot of times it's not how people end up utilizing it, but it's there in case they want to. Any questions? Okay, well, those are the big three that we need to consider as we're getting closer to retirement, how these things could affect the overall scenario, so to speak. When it comes to medical, get to retirement, and almost everybody, there's some exclusions to this of course, but almost everybody ends up going on Medicare. And there's a lot of misconceptions about Medicare. Medicare can be, it has three parts, that's the number one thing. At age 65, whether you're working or not working, you are enrolled in Medicare Part A. There's no premium for Part A. It covers any inpatient care. So anything that you need to be in the hospital for, it's going to cover. There are, of course, things that are excluded in there that need to be taken into account as well. That could be some out-of-pocket expense. Medicare Part B is the second part. You don't automatically get enrolled in that. So if you're still working, you can have private insurance and not be enrolled in Medicare Part B. But after you retire, most people will enroll in Part B because it'll be less expensive than taking your work benefit. But that one comes with a premium. It changes periodically, and in most cases they'll take the premium right out of your Social Security check. And then the final part is Part D, which is the prescription drug plan. These are administered by private insurance companies, but through the Medicare plan. So you can see now it starts to get a little bit complicated. It's a supplement. Some things are covered through straight Medicare, some things are not. It's a supplemental insurance to cover specifically drug prices. You hear about the donut hole that most plans have. It's kind of a reverse deductible, so to speak, where they'll pay first dollar up to a certain point, and then the donut hole kicks in, or the deductible kicks in for a period of time where you're out of pocket, and then it restarts again after you've reached the deductible, so to speak. In recent years, it's probably almost a decade now, there have been insurance plans that have been rolled out that wrap all three of these into one. They're called Medicare Advantage plans. Sometimes you see them as Medicare Part C. Companies like Humana have a big market share when it comes to Medicare Part C, but you're foregoing the traditional Medicare and Medicare Part B and Medicare Part D for an outside plan administered completely through an insurance company. So that's something to make sure that you're aware of that's out there. Some people like that better, some people don't. But regardless, when it comes to Medicare, there are lots of holes in Medicare, things that aren't paid for. So most people end up buying a supplement. And what a supplement does is kind of fill in the deductibles, fill in the things that are not paid for with Medicare, and supplements the plan. And Part C plan does both of those at the same time, okay? So after we realize all the things to think about, you also need to think about, well, what are we going to spend in retirement? A lot of things factor into that. Big things, social. Are we traveling? Are we, what are we doing in retirement? What type of life do we want to live in retirement? Because we have to start putting an estimate on what these things might cost so we can compare that to the income streams that you have, whether it's para, Social Security, other pensions along the way, deferred comp, all those things all play in together. Also plays into the longevity of the plan. You know, when it comes to retirement planning, there was a LIMRA study years and years ago that actually took a look at how people live in retirement. And what we figured out is that during the first phase of retirement, let's call it the go-go phase of retirement, people actually spent a considerable amount equal to even above where their income was prior to retirement, right after retirement. That period lasts between 7 and 10 years. And if you think about it, when they surveyed these new retirees, they were traveling, they were healthy, so they were doing a lot of things that maybe they had delayed during their working years. And now all that pent-up demand was let out on the economy, and they were doing all those fun things. Realizing that if we have a lot of spending early on in retirement, that could affect how things look later in retirement. But some other factors that came in, about 7 to 10 years out, there was about a 30% decline in people's spending around age 70, between 70 and 75. And at that point, it kind of slowed down. They weren't spending as much, they weren't going on as many trips. Health started to become an issue where they couldn't maybe physically go, which gets into the physical part of retirement. And then at the end of retirement, about another 10 years out, there was another significant decline to around 50% of pre-retirement income. So they were dubbed the go-go years, the slow-go years, and the no-go years. So if you see that around, that's what that's about. But on average, if you average everything out, about 65 to 70% of pre-retirement income was required to take care of all of that. Of course, big things that play in, physical activity. Some people retire and they literally sit on the front porch swing, and that's their retirement. Not much physical activity. But the social end and the mental end, the stimulation becomes important. There's recent studies that the mental stimulation of being social in retirement and doing things in retirement plays into how long people might need care for things like Alzheimer's or dementia. So all these things play into retirement and things to start thinking about early on. So once you think about how retirement might look, we have to start thinking about how we might utilize the different income streams that you have. And I call this the three-legged stool of retirement. It used to be everybody had these. More and more, as we get farther along, less and less people have all three of the three-legged stool. Great thing about public sector is that we still have them, especially Minnesota, a very strong pension plan. Most people save on their own, and then most people have access to Social Security unless they're a public safety worker and didn't have any other working income to qualify for Social Security. But when it comes to how these things play together, there's things to think about, like when it comes to personals, like the taxation, number one. In most instances, pensions, Social Security, and personal savings are all going to be taxable, especially if you're taking part in plans at work. Most of them give you some tax advantages to utilize them, And therefore, when you start using them in retirement, they are taxable. I'm thinking specifically deferred comp as the part that I deal with most. It's a nice tax savings up front, gross tax deferred, and is taxable when you take it out. So if Roth is available, might be something to weave into the equation. Doing Roth conversions along the way, maybe as you get closer to retirement, can be a strategy that people take advantage of. A lot of times when pensions, Social Security are added up and you start taking money out of deferred comp or other taxable vehicles like an IRA or an old 401k, things like that, we have issues where we jump into higher tax brackets and pay higher percentage tax than maybe we were intending to. And so being strategic, even as early as when you start some of the personal savings plans, can be to your advantage when you can get to retirement. When it comes to deferred comp, which is what I deal with, a lot of the question I hear the most is, especially when you get really close to retirement, is how do I do it? How do I start taking money out? And the simple answer is it's however you want, really. You take a lump sum, take it all, realize there's tax implications there. You take portions out, what I call ad hoc withdrawals. And this is where I see what most people do, is when they need some money, they want to go on a trip, or buy a car in retirement, they want to do something and they don't necessarily have the cash on hand, they'll start utilizing deferred comp as partial lump sums or an ad hoc withdrawal. For the most part, it gives you the most control over the taxation. If you're going to buy a car, but the taxes on a full withdrawal for the price of the car maybe jumps you into a higher tax bracket. Maybe you take a loan out and pay it off over two years. Take part of it this year, part of it next year. A lot of different strategies that can be played with how the taxes come out. There's also a systematic withdrawal where you tell NationWide or the other deferred comp companies that I want so much a month to come out of but I don't want to lock it up. I want to be able to start and stop it if I want to, but I want X amount of dollars every month for the foreseeable future. It's called a systematic withdrawal. It will come out across the board in most instances, so you lose a little bit of control and discrimination on which investments you might be pulling from. But every month it will pay out regardless until the money's used up. And then finally is the lifetime payout, or the annuity option, where you come into an agreement with the provider and yourself to get a X amount of dollars for the rest of your life regardless. People call it an annuity, or a deferred comp can be an annuity. There's different options as far as making sure that your principal is not lost, so to speak, and make sure there's a period certain, but there's lots of different options when it comes to that one as well. So reversing back to as early as possible and starting to think about how you might want to take the money out is important, because it could change how much you want to save for the front end of retirement based on how you want to take it out over time. That's that. Questions? Goes much better if we ask questions.